Hi, my name is Dr. Cherie Tulloch. I'm an obstetrician and gynecologist here at Mount St. John's, and today I would love to speak to you about cervical cancer.
So together, let's beat it.
Cervical cancer is actually one of the leading causes of deaths by cancer in women after breast cancer here in the Caribbean, and it's also one of the most preventable cancers. Cervical cancer is cancer of the cervix. The cervix is actually the neck of the womb, so it's at the lower part of the uterus where we carry our pregnancies or babies to term. Now, cervical cancer is a cancer that takes years to develop, and because it takes years to develop, we actually have the opportunity to do the pap smears and pick up changes even before we get to cancer of the cervix, and that's the key thing to preventing cervical cancer. Now, cervical cancer is caused by the human papillomavirus, and unfortunately, this virus is probably just as common as the common flu virus. And this is because once persons become sexually active, by the age of 18 to 22, about 75% of persons would have already been exposed to the human papillomavirus. Even for persons who are not sexually active, up to 50% of those persons will still be exposed to this virus. Now, this virus actually has many different types, and there are certain types of the virus that are actually, have been mostly linked to the development of cervical cancer. Now, what are some of the factors that increases a person's risk of going on to develop cervical cancer? Well, there are a few. But first of all, for persons who actually become sexually active early, who have multiple partners, if persons who do not use a condom, persons who are with someone who is known to have the human papillomavirus, or who has had for a lady who has been with a man who has a history of penile cancer, or has had a partner who has had an abnormal pap smear, would be at increased risk for developing cervical cancer. If persons have other conditions on board that affect their immune system, such as the HIV virus, that also increases their risk of going on to develop cervical cancer. Now, fortunately, we have a lot of things that we can do to either prevent cervical cancer or to pick it up before it gets to cervical cancer. Recently, within the last 10 years, or for a little more than that, they have come up with a human papillomavirus vaccine, right? And this vaccine is geared towards boys and girls between the ages of 11 and 12, and can be given up to the age of 26 years. The other thing that most persons are more familiar with are our pap smears, which, depending on the type of pap smear you do, should be done every 1 to 2 years. Now, there are other things that can be done along with pap smears to help to identify persons who are at increased risk for going on to develop cervical cancer, such as testing for the actual HPV virus. Unfortunately, this is not commonly done, and so most persons just do their pap smears. However, if you're doing both the HPV testing along with the pap smears, some persons may be able to go on to do their pap smears every 3 years instead, once both are normal. Pap smears should be done starting from the age of 21 and go on and should be done up to the age of 65 once the last 3 pap smear results were normal, as well as the HPV virus testing was also normal. Now, the pap smear is a very simple procedure. Most women do not like the actual speculum. However, doing the pap smear itself is actually not painful. And so we encourage women to do their pap smears every 1 to 2 years. Once you've done the pap smear, you may get back a result that's normal, which is actually most of the time you'll get back either a normal result or a mildly abnormal result. In those cases, depending on what it is, this is usually something that we can either treat or monitor closely. For persons who come back, who get a pap smear result showing more abnormality, moderate to severe abnormalities, more indicative of the possibility of either precancerous changes or possibility that we may be dealing with cancer if they're in the cervix, then we would go on to take a closer look. So those persons go on to do what we call colposcopy, where we take a look at the cervix using a microscope. Just like the pap smear before, we use a speculum and we take a closer look at the cervix, and if we apply certain solutions to the cervix, and if we see an area that looks abnormal, we take some of that tissue and send off to the lab. And depending on what that comes back showing, we may have to do definitive treatment. Now, there are about 3 stages of abnormality that you go through before you get to cervical cancer, and the higher the grade of abnormality is, the less likely someone is to actually clear the abnormality on their own. Hence why we would offer treatment in those cases. Sometimes it just requires us applying, like freezing that layer of abnormal cells. Sometimes we actually have to completely remove that area, we call like an excision or a loop excision, and we send those off to the lab. And once that's okay, after that, persons just need to be monitored very closely. Once you get to if someone goes on to have a more abnormal results, or they came in with signs and symptoms that indicated that they possibly have cervical cancer, and therefore we bypass doing a pap smear. And what are those symptoms that we sometimes see? An abnormal discharge, any lady that comes in having abnormal bleeding after sex, any sort of bleeding after sex or in between their periods, are some of the signs. Some persons come in with pain in the lower abdomen or pain in the legs, and they may have some other symptoms like weight loss or so, depending on how advanced it is at the time. In those situations, we would of course have to take a look at the cervix, and we would take some of that tissue, send off to the lab, and if it comes back showing cervical cancer, then we start talking about treatment. And treatment really depends on the extent of the disease, and it can range from just doing simple surgery where we remove the entire uterus, called a hysterectomy, a radical hysterectomy rather, or it can be as far as having to do chemotherapy and radiation. Depending on which stage the person is in the disease progression of cervical cancer, would determine how likely they are to achieve a cure, right? Our aim is always to try and achieve a cure, but of course, as you get to the later stages of the disease, achieving a cure becomes less likely. However, we encourage ladies to look out for the symptoms I mentioned earlier and present early to us, so we're more likely to treat successfully. Of course, persons that have stage 1 or 2 are more likely to achieve about 90% of the time. We may be able to completely remove whatever is there, and they have pretty low chances of recurrence of disease. I fully endorse Myst Carnival and their efforts to raise awareness about cancer, not just cervical cancer, but for all cancers. We can come together, we can prevent cancer. Let's beat it.